Hello, everyone. Welcome to the New Mexico FAP Echo session. This is our fourth in our series of sessions. We want to welcome you. I know that there are going to be people logging on as we go. We are expecting a few more people, but do want to welcome you. New Mexico Family Advocacy Program is a program that's being implemented in the 13th and 2nd Judicial Districts. It is comprised of we use an interdisciplinary team of lawyers, social workers, and parent mentors working effectively together to provide quality parent representation in our court system so that families get the proper advocacy and support they need for reunification or other preferred outcomes. Participants in our community of practice, and that's what we're building here with these echo sessions, is our community practice will receive professional development from experts and early adopters of their NMFAP model. And at the same time, we will be learning best practices and collaboration to solve complex issues of providing quality parent representation in the court system. I'm Leslie Jones. I was one of the attorneys in the pilot program in the 13th Judicial District, and I am now the attorney mentor for the program.
Thank you, Leslie. And good afternoon. I'm Dr. Michael Stanton. I'm providing technical assistance and support to the NMFAP ECHO project, and I'm very, very happy to be here. We'll do further introductions here at the Hub, starting with my far right, our amazing coordinator and IT specialist today.
Hello, everybody. I'm going to be providing technical support today. My name is Laura Arguelles. If you have any questions, you can chat with me. To open your chat window, if you look on the bottom of your Zoom screen, there's a chat button. That should open up the chat. Also, if you're on the phone today, you can use *6 to mute and unmute yourself. Thank you.
Thanks, Laura. And then we'll introduce you in just a moment, but we'll, Christy.
Hi, I'm Christy Fields. I was also a social worker during the pilot period, and now I'm a lead social worker for the program.
Thanks, Christy. And so that we can make the best use of our time, if you could just take a moment right now to go into the chat window. If you can look down at the bottom of your Zoom window, you'll see chat. If you click on that and open that window up, that sidebar, just put your name and your email in there so that we know who's here. And we'd really appreciate that. Couple other quick announcements. Please take a few minutes before we leave today, right around noon. We should be finished. Please remember to complete our post-session feedback and reflection form. And Laura is going to be putting that into the chat window now, and then we'll put it in again a little bit later. So our chat window will be pretty helpful for us to put in some of those links for you to interact even more with in our ECHO session. As you may know, funding for our professional learning through the NMFAP ECHO is from a federal grant. And as you would know, these surveys are very important to the program's broader evaluation and continued funding. So your response, your thoughts, your reflections from these post-session feedback is really important. Thank you. One last announcement. Please take an extra moment if you can. We want to really thank Catherine today, but we're again looking for one and maybe even two presentations for cases at each one of our sessions. Typically, again, our agenda will start with about 25 to 30 minutes for our workshop, and then another 30 minutes for case presentations for those challenging dilemmas that you are facing in your practice, and share with us for some advice and recommendations from not only the specialists here, but from all of you. So please take a moment, if you can put a couple weeks from now or later on this summer, go ahead and sign up with your name and your email. That would be great. And then Laura will get in touch with you with the correct form, okay? Leslie?
Thank you, Mike. So our workshop today, our presentation is Incorporating Trauma Responsive Care in Interdisciplinary Practice. I am really excited to hear this workshop and what Cristen Conley has to say about it. It's very relevant to our practice. Cristen Conley received her JD from Baylor University School of Law and has been an attorney since 1988. A certified child welfare law specialist, she is a senior attorney for the University of New Mexico's Corinne Wolf Center for Child and Family Justice. Cristen was in private practice for 28 years, serving as a respondent's attorney, youth attorney, or guardian ad litem, and as a guardian ad litem for incapacitated respondents in child and family welfare cases. Cristen was awarded a certificate recognizing excellence in service as a child youth law advocate attorney by the Supreme Court of New Mexico and the Children's Court Improvement Commission in 2018. She's been a local and national trainer on the law for her entire career. Cristen is also a board member for Casa Q, a transitional living home for LGBTQ youth. So as you can see, she's got a tremendous amount of experience that's very relevant to our practice. And welcome, Cristen.
Thank you, Leslie. Hello, everyone. As Leslie said, I've been doing this a while, and we used to joke, Gene Connor, particularly with CYFD, used to hand pick me on certain cases because for some reason I was gifted with an ability to be patient and work with people in a way that I think sometimes many of us are not always good at. I say that I certainly have gone in and out of being the best attorney that I can in working with folks that have some significant issues. Usually when you start a training, you want to talk about what's in it for my audience. And I'm actually going to do the what's in it for you a little later on in the presentation, but here is what I would like to say at the outset. My personal experience in using these techniques or techniques that I've just stumbled upon through the years is that it may require more time and attention at the outset of a case and at the beginning of a relationship with a client. But then as you develop that trust and relationship with them, things can move much more smoothly and quickly.
Oops. There you go. You can do this.
Thank you. There we go. So many of us here are inherently empathetic. That may be part of the reason that brought many of us to this particular sort of work. Social workers may have formal training and know much of this already. I'm not going to pretend that I know exactly what social workers are taught as they go through their educations. But more and more of us, particularly in this sort of field, have been exposed to or sought out information on trauma responsive techniques. Family advocacy teams together should work together to decide how to respond to traumatized clients. This presentation is about ideas to use in the moment, not your overarching idea of how to work with a family, but particularly when something goes rough at the time. I recommend that attorneys not just pass this work off to the social workers, thinking, well, the social workers are the ones that have the training in this. These techniques can be protective for all of us professionals in this meeting room, not just the client. And keeping us in the work is important because the work we do makes huge differences in people's lives and addresses basic constitutional rights that all of us have. I'd like to do a training where we actually practice using these techniques, but obviously this is an extremely brief presentation, and so we won't be using any experiential techniques at this time. So, really basic things. We'd like you to be able to recognize possible symptoms or signs of trauma exposure in your clients. We'd like you to be able to describe what are 3 different elements of a trauma responsive approach to your practice, and then what are 2 benefits of trauma responsive work with clients. And note that I'm not saying benefits to the client, I'm saying benefits. It can be for the client, but it might be for you. So let's start with a poll here. Think of what are different types of traumas that our clients face by the time we get them.
So we're going to, bear with me, we're going to do something different. And if you can take a minute and find your browser, and I'm going to move ours over to here. And sorry, well, it's shrunk on me here. Okay.
while he's looking for this, you know, think about what are various types of trauma? What have you come to recognize in yourself or your clients? Many of you know I had a bad break on the ski slope in January, and I still am extremely labile 4 or 5 months later. I'm really startled by that. But man, you can say something and I will cry at the drop of the hat. It's very embarrassing. That's a sign of some of the trauma. So it may not be just what's happened with your clients, but what comes up for you.
Well, bear with me one more second.
And you can move on in a different manner.
Sorry about that.
No problem.
I don't know how to get this bigger.
How weird.
This read is covered.
Right.
Maybe this looks like it's locked up.
What's that?
It's locked up. Do you maybe want to try to shrink it down, or can you even do that?
No.
Something else.
Oh, I'm so sorry.
Well, we can just go ahead and move forward with
Yeah.
this. So let's think about some things. Let's see, for those of you we can see on the screen, raise your hands if you have experienced or your clients have experienced racism, ethno-violence, and that would be anything because you're a member of a particular ethnic group, people that have come through terrorist attacks based on the kind of culture they're from. Obviously, homo or transphobia. There's historical trauma. Think about our Native American communities here, or think about African Americans who their families were originally enslaved when they came over here. It's hard to move out of that when your grandparents and your great-grandparents and your great-great-grandparents were victims of these sorts of trauma. War, terrorism, or even community violence. We hear worse and worse things about things that are happening in Albuquerque, and I'm sure there are certain neighborhoods where that is more and more scary for children. Group trauma, that's particularly for people like firefighters or soldiers. Exposure to domestic violence, not just being a victim of domestic violence, but just seeing it happen. Maybe you saw domestic violence happen in your own families. Maybe you know that it's happening in your clients' families. Of course, sexual assault, loss of a loved one. That can be through a bad divorce. It can be through death, or just moving cross country or across the world. Accidents, natural disasters, medical injury, like I mentioned with my broken shoulder, illnesses, procedures. You know, how many of us, I used to very easily go in and donate blood, and as things have gone on and I've gotten older and I've had more circumstances come up, it's harder and harder for me to do that. Neglect can be a huge trauma to people. Psychological maltreatment, and then of course we get to the even more pointedly appropriate things in our field: child abuse, complex trauma, which means multiple traumas suffered, usually starting with some form of child abuse or neglect. System-induced trauma. How many of the families we work with have had kids that have been moved 6, 7, 8, 9, 10 times? I had one family of kids I worked with years ago that I think all told there were 24 moves for the 3 kids. And then, of course, for all of us as professionals, the secondary trauma, as we start to take in and deal empathetically with the things that our clients have gone through. Let's talk about ways that trauma can manifest. What are the effects? How many of us, and let's just do hands here. How many of us have worked with clients that were crying, yelling, or cursing? I know this is going to be kind of stupid because it's probably going to be all of them. Just being silent, not responding to you. Your clients don't respond to you or don't respond in meetings. Or court, worse. An inability to stay seated. How many clients have we had that got up and stomped around or threw themselves out of the courtroom? Not following our good directions and advice, not following the directions of the caseworkers with CYFD, not following the directions of the judge. Illness, pain. We have clients that may show up with what look like chronic ailments, and actually having illnesses that have come up because of traumas. We know that high exposure to ACEs, adverse childhood experiences, makes us more likely to suffer from particular illnesses. Not participating in activities, missing appointments, in spite of literacy, a seeming inability to read or comprehend materials. I've had that happen with clients. Constant attempts at contact with the professionals, or avoidance of contact with the professionals. I've had both of those with my clients. Overwhelming pessimism. I give up. It won't make any difference. I can't do anything right. Checking out or dissociating. Self-medicating, which is about 85% of our cases. So they're maladaptive responses to the trauma. They're a way to get some sense of control over what's happened or their feelings. Oops, that was interesting. There we go. So in general, here are some general approaches to use when you think your client struggles with the effects of trauma. Always make sure that you are taking direction from your client. And we'll circle back around to that as we get to some of these other points. Meet in a quiet, safe place, but check in with your client what that means for them. I had one client who only wanted to meet with me in a room that had windows that he could see through. I've had other clients who only wanted to meet with me in rooms where nobody could see in. I've put paper up in front of the glass panel on a door, for example, meeting with a client. Provide food. Now, there are certain clients, particularly when I'm going through a day-long termination of parental rights trial, I'll take them to lunch. I can't even imagine the isolation that comes when that's happening. And besides that, we all think better when we've got some food in us. There is a fascinating study that Daniel Kahneman, a professor of psychology at Princeton, done back in 2002 on the psychology of judgment and decision making. And he has a book, Thinking Fast and Slow. The most famous study was a study of Israeli judges. They granted parole just after lunch, and the farther they got away from lunch and later on in the day as it got closer to dinner time, the fewer and fewer instances they would grant parole to criminals. Hungry or ego depleted judges tend to give less careful consideration to details of cases. So imagine what's happening for our clients who may have significant food insecurity, or even for us. And I chose a kind bar on purpose, of course. Be consistent. When you say, I'm going to call you today, call them today. If you really can't, though, and this bump down a couple, keep your promises and don't overpromise. If you really can't make the call on that day, don't say, I'll call you today. Say, I will call you at 4 p.m. tomorrow. Check in both before and after court. Ideally, you've met with them a couple of weeks in advance and been able to develop witnesses or determine what their side of the story is on what's been happening. But then double check right before court, and many clients will need you to call right after court or meet with them right after court. Okay, this is what just happened. Let me make sure that you get it. You may want to take notes when you're meeting with your client. You might not. Ask your client. Take direction from the client. Are you comfortable if I'm writing this down? Would you prefer I not write this down? I had certain clients that I would make a point of not taking notes. And ask for trauma responsive accommodations in the courtroom. Frequently that can be done. And that might be as simple as putting a piece of paper over the glass window into the courtroom. Now, specific approaches. What if you have a client in terror? That might look like fight, flight, or freeze. Regulation to help them control themselves may just be supportive. Maybe, if it's possible, help them remove themselves from the situation. You're not really going to get through to people who are in terror. Their minds are just racing with surviving. So maybe just breathing calmly with them. And we know that if we breathe in a calm and measured manner, it can help the people that are around us also begin to control their breathing. Don't try to talk with them about the case or what just happened in the meeting. Just talk about you're safe, nobody can get to you, we know your kids are in a good place, etc., as appropriate. Don't try asking questions. They're not going to be able to be in a place to talk with you about it. If they're afraid, and this is interesting because it can frequently look like defiance or anger or, don't tell me no. Ask. Again, the breathing trick and besides that, once again, the controlled breathing will help bring you down if you've gotten escalated because of how upset a client is or some shocking thing that's been said or you heard in a case. It can also help you. Ask, maybe it's something simple. Will you walk outside with me? I see how distressed you are. Let's work together to make this better. And then you write things down for later reference for the client. Be prepared to give them a note. This is what we talked about today. Specific approaches. What if they're deeply grieving? I had an interesting experience where I was asked to fill in at the last minute for a respondent attorney who had a medical procedure that came up, an emergency is really what it was. And I met her client for the first time ever, and this client was seen as being uncooperative and obstreperous and obstructive. And I sat with the woman and talked with her and realized she was in deep, deep grief and shame. It was astounding. And if they're sobbing, maybe the only answer is just give them tissues, just sit with them. I see you're sad. If you're not in a public meeting, tell me, what are you missing the most? Something like that. And then I know this sounds kind of hokey. I do ceremonies, and I don't mean like I'm lighting candles and waving incense, that sort of thing, but let us, take it seriously. And I may take a piece of paper and purposely lay it in front of me and say, what do you miss the most with your child? Or what did you do with your child before? Or what have you done to try to get control over this? And then, so you're honoring the client's grief, you're honoring where they're coming from, but you're also creating a document that can help you to present something in court to build that client's story. So then, why do we do this? For them, it increases their ability to participate in their own cases and get their kids back. It helps them calm down. How many of us have the client and the caseworkers for CYFD just see them as out of control and angry and raving? And if we can help them get to a point where they can focus that energy, then we help them participate in their cases. It regulates them and it helps them take in new information. They can be seen and heard for who they really are, not with the veneer of their fear or anger or pain that arises out of the trauma. And it helps them get all of their story out. For you, for all of us, it reduces our secondary trauma. It improves our home lives. I know during those periods when I was working 12 and 14-hour days for weeks at a time, my beloved husband, who's pretty funny, would tell some joke and I'd be like, is that supposed to be funny? And his response was yes, at which point I knew I needed some additional help. It can also reduce the risk if you're using a trauma responsive approach and being tuned into your clients, it reduces the risks of complaints filed against you, either with, I don't remember the name for the board for social workers, or with the state bar for us. It also models good behavior for those of us, for the people around us. If we're able to be calm and cool and collected, help our clients dial down, maybe we can get the other attorneys or the other workers in the case to be in a better space. It improves our ability to offer high quality representation because we have clients that can be tuned in, that can trust us more, and that we can trust more, and it keeps us in the work for longer. We do this because there's social utility, because we believe it's important for us. So finally, wrap up. Be available. Oh no, that was my timer.
Oh, you're right on time.
Yes. Sorry.
It worked.
Sorry.
You're
Okay,
fine.
there, my last slide. Oh dear. Oh no. Be available. Be unlike this where I'm messing with my phone. Be consistent. Be where you're going to be when you say you're going to be there. Be calm. Be simple. When your client is excited is not the time to get them to list 8 things for you or for you to tell them 8 things that are going to happen. Give them 1 or 2 things. Have a simple list for them. Be fully present, not messing with your phone. Be curious. Find out. Learn from them what's happening. How did they get to this place? The woman I talked about that I covered for the attorney once, we changed the kind of therapy she was in at the review hearing that we were at because of the grief that she was going through. And be their true voice, help them put forward their true voice. Thank you.
Thank you.
Thank you so much, Cristen. So now we'd like to open it up for any questions, requests for clarification, anything like that from anybody out there. If you would like to ask a question, please raise your hand and we will unmute you and make it so that everyone can hear your question or comment. Does anyone have anything? Brian.
Hey, Cristen. So I was just wondering what advice you have for working with very narcissistic clients, ones who are really self-interested and have a lot of difficulty accepting accountability for their actions. Because I know I have quite a few of those.
Okay, so I am going to say that now, I'm going to say this is beyond the scope of my presentation because those folks are not feeling trauma necessarily.
Right.
Although they may be, it just manifests in a different way. But here's the thing with narcissists. Narcissists, everything is about them. You talk with them about how do they look good? How do they look good to the court? What makes them shine in somebody else's eyes? What's the best thing they can do? And so honestly, my experience with narcissists is you just feed into it and you use it and you fold it back in on them.
Okay, that's really helpful.
I am not a psychologist. I'm just playing one.
That's really helpful. I know a lot of the parents that I work with too have a lot of generational trauma, and they were abused or neglected as children, and then that sort of comes into play and comes out in seeing those sort of tendencies, and so it's helpful to see how to address that.
Yeah, and I think it's just really important to honor them and honor, be open to that old story. And again, at the beginning, your meetings may have to be 2-hour meetings with your clients, which, you're sitting there thinking, oh, I got to get going. But that will set you up for 30-minute or 20-minute meetings on down the line once they get to know you and trust you.
Well, thank you.
Thanks, Brian. Anybody else have any questions, comments? So I do want to say that I feel like the interdisciplinary model of practice really fits beautifully with this because we have a team. Mm-hmm. So when we've got a client who's really experiencing trauma, however that's manifesting, that we have the ability to have the social worker really pay attention to that, or the parent mentor really pay attention to that and focus on that. Or depending on the alliances, I suppose it could be the other way around. I mean, if it just so happens that the relationship is better for whatever reason with the attorney, but that still leaves the other team members to be negotiating with the department, to be, to create a better space, a more functional space for the client where they can do better. So I think there's so much that we as teams can use from this. I feel like it's really great.
Thank you. And I want to be clear that some of these materials or some of my experiences and what I presented today also came, I was lucky enough to be able to go along with Leslie to the ABA conferences on child and family representation just a couple of weeks ago. And we talked about interdisciplinary teams. And when I wrote my presentation, I was thinking about not just attorneys, but the social workers that are partnered with them, with the parent advocates that are partnered with them.
Anybody else? Or did you want to say something else?
Well, one other example, and those of you that have come to core training with me may have heard this story, but I had a client that just drove me crazy, and she was calling me 2 and 3 times a day. You're not doing anything. What's happening next? And finally, I was in therapy at the time. I go in and out of therapy from time to time. And the therapist said, "Do you wish her harm?" And I was stunned. And of course I don't wish her harm. And out of that, I realized, no, I'm going to set a regular time to call this client. And what I told her was, I will call you, I'll make this up, on Wednesdays at 3 o'clock. First week, she was all excited. It was great. I was able to tell her everything. She was able to follow my boundaries of not reaching out outside of that except for specific emergencies. The second week I called her. The third week, she's like, oh, you don't have to call me anymore. It was stunning that by being responsive to her, being available, setting up a plan. So that's a sample of the kind of thing of reaching out to the clients.
Christy, did you have anything else?
I think the only other thing I want to add is some of the things that you talked about, Cristen, especially about the some of the defensiveness behaviors that are really manifested from fear of losing someone's children, is that something that as an interdisciplinary team that we can do as social workers and lawyers is when we know our clients, is we can do a better job at educating the department and the other team members, whether that's their PBW and supervisor or whether that's other providers who are at the table, let's say PB and J, about okay, so what I know about this person is that when this is happening, this is really where this is coming from, and this is what it looks like. So if it's helping incorporate the team's learning about this particular parent and how we best help them through their treatment planning with the understanding of the trauma that they have had in the past. If that makes any sense.
Yes.
Mm-hmm.
Thank you, Kristen. And thank you so much, Kristen.
Certainly.
That was really, really, really important. Folks, we're going to transition now into our case presentation segment.
Nita has her hand up. I don't know if she did it on purpose.
Oh, Nita, did you have a comment or a question before we move on?
I just had a question on how do you kind of deal with this idea where your client has completed their transition plan, their treatment plan, but yet at the same time they're doing good, they might be doing visits or whatever, but there's always this kind of backdrop, this pushback. Well, they haven't internalized and taken responsibility for what brought their kids into custody, even though they may have taken a plea or had several therapy sessions with their therapist on these issues. How do you, because sometimes I think there's this ideology that they have to agree to all the allegations as to why the child came into custody and just always flog themselves in order to have this kind of dialogue that they're an acceptable parent, that they're ready to parent. And I just don't think that's true, because there's a lot of fear behind losing their kids or mistrust of the department that's kind of inherent in this work. And so I'm wondering if you had any suggestion on how to deal with that, because it is kind of a trauma to parents as well to be separated from their children.
I agree, Nita, that that's a significant trauma to parents. That's loss of a loved one. With that list that we put up before, I agree. You know, I'm a big fake it till you make it fan. And because I also think that as we shape our thoughts and our activities, it shapes the way we feel and think about things. I used to tell clients that the ones that got their kids back were the ones that said, "You're right, I screwed up, I need help," and then accepted help from CYFD, which that's the hardest part to get over, I think, frequently. But I would talk with them about how the caseworker saw themselves as their child's best friend and protector, and at least that caseworker was working to make things better for the child, even if they didn't particularly, even if the parent didn't particularly agree with it, that at least it was coming from a good place. Now, mind you, I recognize that's not always how things go down, but again, fake it till you make it. And then the other thing is, if you're in a position of trust with your client, you have a serious conversation about what can you tell me that you wish you had done differently, because maybe that's the way, not accept responsibility for how you screwed up. And I'm using the coarse language on purpose, but maybe they can say, this is what I wish I'd done differently, setting up that circumstance or getting out of that circumstance.
Thank you. Thank you. And again, you know, Nita, I really appreciate you raising that question, because questions like that could be very easily converted into a little bit longer case presentation in the future, where you might want to, you know, kind of generally, it could be about a specific client, but it could also be in general. You know, if you've had through several folks like this that have represented a particular challenging, complex dilemma that might fit, you know, for the rest of us to kind of help problem solve and think through with you. So thank you for sharing that, Nita. And again, another reminder for our folks before we move into the case presentation forum is, if you'd like to go ahead and sign up for one of our sessions, you know, as you know, we're meeting every couple weeks. You can again look at the list of our subject matter experts or specialists who are presenting in the weeks and months ahead that Laura has listed and shared with you on our invitations and so on. The one last announcement before I move on, two quick ones. We have a participant with the last 4 digits on their phone, 8341. If you get a chance, if you could make sure that you just type in, if you could maybe even send us an email, or I don't know if you can use the chat window, but if you could send us an email and let us know your name and email number, that would be wonderful, email address. So thank you so much. One last announcement before we move on, because we may lose a person in this next session in our case presentation. Please remember, if you do need to leave early in any one of our sessions, please take a few moments to kind of put down your thoughts before you leave, or certainly later on by the end of the day in our post-session reflections. It's really important for us to see those and to kind of hear what works and what is not working, what resonates with you, and what some of the next steps and questions might be. And that post-session link is in the chat window right now. Okay? All right. So we're going to move on to our case presentation session. And before we do, Laura, is there anyone that we need to?
I think just the second judicial conference room is the only one that I see needs to be disconnected.
So our friends in the judicial conference room, thank you so much for joining us. We're going to need to let you go, because this next subject of the case will be could involve some of you who are in that room. But we thank you so much for joining us. And at the same time, I'm going to stop recording. And thank you so much. We'll see you in 2 weeks.